My paper was on why 3 types of therapies is better than electric shock therapy. For my slideshow, I used that paper but broke it up, which is going to allow me to explain it better in the pros and cons for example. So we have the history of mental psychosis, the symptoms, how it's treated now, individual therapy, pros and cons, cognitive behavior therapy, pros and cons, and electroshock therapy, pros and cons, and cognitive enhancement therapy, pros and cons, in conclusion. So history of psychosis. Psychosis has been around since the medieval ages, but during those times, people were actually thrown into jail and beaten because of this, because people thought that they were either witches or demons. I've seen the photo here, they're cutting open a man's head, believing that they do this, it would let out the demons. But we did this because we never understood the human mind yet. And what they saw, because some of the symptoms were speaking to things or seeing things or believing in stuff, then they thought they're either witches or demons. But once Western society began to grow, the help of mental illness, like psychosis, started to get better. During the French Revolution, a man named Philippe Pinel has opened a free mental health hospital. It's helped remove the chains from people with these problems. The term was first introduced by Carl Constance. He used the abbreviation psychic neuros. Neuros is a term for nervous system damage, disease. As seen here, we have an older photo showing each part of the mind, how it would work. A man called Ernest von Huchersleben was another widely known psychologist in 1945. He used the term insanity and mania, which means insane or crazy. In the late 19th century, a German psychiatrist called Emil Kraepelin announced a new clinic approaching mental illness as opposed to symptomatic. He reclassified all mental illnesses into shared patterns of symptoms and syndromes, which is like the effect they can have on other people, rather than grouping them based on major symptoms, so that some are bigger than others. Kraepelin is known as the father of modern psychiatric classification, mainly classifying psychosis into two different categories. Alright, the symptoms. The difference is symptoms. The first category is the early symptoms. These symptoms are worrisome drop in grades or job performances, trouble thinking, ability or concentrating, suspicion or unease with others, find self-care or personal hygiene, spending a lot more time alone than usual, strong and appropriate emotions, or having no feelings at all. So a good example of one of them is if Ms. Miller notices a kid isn't doing his work as well, his grades are dropping insignificantly for no reason, and he's kind of moving away from his friends and not really communicating, that could be one of the symptoms. Not definite, but it could be one of them, which is a good sign. Or they can't just focus well and are having trouble thinking during the school day. The next symptoms are the first psychosis symptom. They're hearing, seeing, taste, or believing things that others don't see or hear, and usually thoughts, beliefs, or beliefs that can't be set aside regardless of what you believe. Strong and appropriate emotions, again, because that can always stay, even though it's the first symptom, we can just get worse. Or no emotions at all, withdrawal from family and friends, or sudden decline in health, self-care, trouble to create or concentrate. So a good example of the speaking to someone is you could walk into a room and someone could just be sitting on a couch talking to no one there. It could be a pretend imaginary friend. It could hear what they're saying, but you can't hear anything. And just see them talking. And the kind of self-care is all brushing your teeth, taking care of yourself. Can also be bad as well. Believing that trivial remarks, events, or objects of personal meaning or significance. For example, the blue pen. You could become very protective over it because you know, think it has a really important, significant value. Like, you would hurt someone if someone like tried to take it away. It's just that important. In reality, it's really not. Thinking you have special powers or on a special mission that you even are God. It may not be true, but this could also be some of the reasons of cult leaders. Because they just believe over time, I have this power or God has sent me on a mission. Reality, it's not true at all. And that's why they just think these things in their mind and nothing's true. The more the hallucinations or strange sensations or unexplainable feelings, seeing glimpses of objects or people that are not there or distortions. So, for example, if Mr. Short was saying that and he looked up, he could think he sees like a black shadow in the doorway, but there's nothing there. It's just like a glimpse of something. And he feels like he's being watched because he saw something there or saw something out the window. By treatments, there are different types of treatments from medications to doctors' hospitals. So there's like hundreds. There are certain types of medication called antipsychotics. These pills can help ease the hallucinations, so you don't see them as much. One of the therapies is the individual psychotherapy, and that's when therapists will help a person deal with thoughts and behavior. Also helps out learning more about their illnesses and effects and telling fantasy from reality. So if someone's like believing they're in another world, this could help ease them out of it, so they don't believe that. Next. Then there's cognitive behavior therapy. This helps this the person change their thinking and behavior. So a therapist will help show how to deal with hallucinations and voices. So they hear something, the therapist will be like, this isn't real, you're just thinking of this in your head. No one's trying to communicate with you or trying to force you to do something. This also combined with medication, which can help predict what's causing the psychosis. Because medication helps with the hallucinations, and voice will help ease it. So if, for example, you have like a fake imaginary friend who's telling you, don't tell them this, your traumatic past, like pretending to try to protect you, the medication can help ease that. So the person they can come out, because psychosis is mainly caused by like a traumatic death or a sad childhood with abuse in it. So the medications could help with that. Another is cognitive enhancement therapy. Teaches people how to recognize social cues or triggers, improve their attention, memory, and ability to organize their thoughts. Again, this could help them remember what's causing it, because now they're able to organize that into one. It also combined with training and group sessions. So people who have this can come together and work on it together to help each other. Then there's Electroshock Therapy. This is when electrodes are attached to a person's scalp and a doctor sends a small shock to their brain 2 to 3 times a day over the period of several weeks. What it does is cause a small controlled seizure, causes medication to work better, and a change in a person's mood. So if they're like really depressed, this can like help them make them a little bit more happier. They're willing to communicate a little bit better. It also can help non-functioning medication working. But some doctors think that the treatment can affect the release of neurotransmitter in the brain. This is when the brain cells communicate with each other as seeing passes, and this may stimulate the new brain cells, which is what neurotransmitters are. They are like what makes new brain cells. But ECT may flood the brain with neurotransmitters such as serotonin or dopamine, which is one of the main conditions. It causes of condition and like depression.
Right. Good job.
One of the main causes, basically. All right, individual therapy. One of the therapies is individual psychotherapy. And this is when a therapist helps a person deal with thoughts and behavior. It also helps out learning more about their illness and effects, telling fantasy from reality. It's just like an intro. Alright, pros. One of the benefits of self-awareness is we went through the counseling process, the one-on-one session, the individual encounters several issues that need to be addressed. So if they're not eating or like working with other people or being social, that can be a problem. So this will like help them ease back in there during their one-on-one conversations. To help an individual to be present in here and now. So this will help them think, what am I doing with my life right now? What do I need to do right now? And like how I can help myself, how I can make myself feel better. Mindfulness authorizes the person to their thoughts, feelings, and sensations felt during session. In addition to this, the counsel also tends to have a high impact on the individual's behavior on the desired outcome. Because they'll be able to see what the person wants because they're like going through the thoughts of how they want things to go, how they want to fix each other, how they want to do it. It can also help the cognitive behavior therapist point out mismatches between what the individual thinks will happen compared to what will actually happen. So a good example is if a person is in a very safe neighborhood, like barely any killings there, they could be thinking that as soon as they step out that door, I'm going to die. When in reality, they won't. So the therapist will help them think, you're not going to die instantly, you're really safe here, you're not in that much trouble, and this will help them ease, which can also help out with anxiety. Alright. Pros therapy continue. A second benefit is self-exploration. This therapy is more like a journey for the patients. During this, some questions are asked like, who am I? What are my beliefs and values? What makes life meaningful to me? And who are the individuals that support me? Again, figuring out who's there for the person, who's going to help them. If they believe in a God, like Christianity or Judaism, this will help them think, what can I do to help? Do I need to like believe in a religion to feel tethered to like this, my own mind? But who's also out there that can help me? These questions are put at the forefront of the individual's mind, so they won't be able to forget this too easily and can like think this over and over again throughout time. The third benefit is health coping skills. During this, the individual gains available coping skills. The therapist that uses this treatment can focus on mindfulness techniques, which can help decrease symptoms of anxiety. Like I said before, it will help them kind of calm down and think, I'm not in true danger throughout this. And this can actually apply to the real world once they're done with their treatment. That they'll be able to go back and be like, I'm fine, I'm not going to get hurt that easily. I'm a lot more safer than I thought. This knowledge can be taken counseling sessions to the real world, like I said. In addition to this, cognitive behavioral therapy encourages individuals to use more coping skills for the thought pattern. So, like working with people more, not being at the house all day by themselves, like going out, meeting new people, making new friends. Alright. So, cognitive therapy. Even though this is a good treatment and can truly help people, it does have some cons. One of these is that this type of therapy is more expensive than group therapy. So basically, if you don't have a well-paying job, you may not be able to complete this because it's too expensive to do. The treatment may help people on their own, but some people have a strong need to identify themselves with others that have the same problem. So since this is just a one-on-one counseling, something that may be better would be group therapy. So they could meet with other people who have the same problem and work it out in the same way. So like it would work like that. Some people may struggle with change during the therapy or oblivious when they are put on the spot. So the therapist may be asking questions but they don't want to answer because their emotions may be too strong and they don't want to confront it. So putting them on the spot would make them more anxious. It can make them struggle when they're a center of attention. It would make it hard for people to talk about certain things with the therapist. cognitive behavior therapy. The second is cognitive behavior therapy. This therapy helps a person change their thinking and behavior. During the treatment, the therapist will show how to deal with hallucinations and voices. It is also combined with medication, which can help predict what's causing the psychosis. Alright, pros of cognitive therapy. One of the pros is that it can be as effective as medication when treating some mental illness. So you may not even have to take pills during this treatment, because the treatment is so effective. It works like the medication can help with hallucination. It also be helpful in cases where the medication does not work. Like I said before, if the medication doesn't work, this is already helping getting rid of their hallucinations and voices they hear. This can help people to make it that has stopped working as well. So it stopped working, this will help as well. They can change something which will help with therapy. The therapy can help stop symptoms the person is showing. So like the hallucination, it can also help stop those to make it go more slowly. Second pro is that unlike other treatments, this can be completed in a shorter amount of time. Because sometimes treatments can take more than 6 months to complete, where this can only take 3 months to complete. So if you want to get it done more quickly, this will be a good treatment to use. It would help. Project continued. The therapy also mainly focuses on returning your thoughts and altering your behavior. It helps make changes to how you feel. So if you are always feeling mad and like anxious, this can help you change that feeling. So you don't feel that mad, that angry, and your emotions will be better. They're more structured than other treatments, which means they can provide different formats, and this includes groups, self-help, and computer programs. So if one part isn't working for someone, then they can always switch into like a group session or a computer program, which could be shown to be more effective. But the skills you obtain from therapy are very useful, which means they can be incorporated into everyday life. Like I said before, this could help ease someone back into society, and they could start living a normal life again once this therapy is over with. Example of this is coping better with future stress and difficulties even after treatment is finished. So you won't have this stress anymore, you'll be more calm. Cons for cognitive behavior therapy. Even though this is another great treatment, there are some downsides. The benefit for this treatment: person needs to have a great amount of commitment for yourself and your process. Therapists can give you good advice, but they can't get rid of the patient's problem on their own, but you can only fix your problems with your cooperation. So if someone's not willing to work with others, if they're just being stubborn because of that anxiety, not wanting to cooperate, then they couldn't really continue with this therapy. They would kind of be like halted until they fix those problems. Attending regular sessions and doing the work can take up a lot of time, because since you can complete it in like 3 months, like the example before, it's going to be longer sessions because they're trying to compact it into a smaller amount of time. Where like 6 months, it would be shorter sessions because you got to span it longer. Due to the structure of treatment, it may not be suitable for some people who have more complex mental health needs or learning disabilities. An example of this is some cases of psychosis are different from each other. This can cause the treatment to not have any effects. So you can have because psychosis ranges in different things. There's like millions of symptoms. So it's always different. It's never going to be the same. There's hundreds of patterns out there probably. So this, for some people, may work, but for others, it may not. And they may need something else to work with to help. Alright, let's continue. During the treatment, you will need to confront your emotions and anxieties. Like I said before, they may not be able to confront them and this will make them not want to cooperate. And this would put this to a halt because you can't go any further. It can cause initial periods where you'll be more anxious and emotionally uncomfortable. This would make it harder for you to focus during the meeting, which makes treatment less effective. You're not trying to think what's going on. You're like, I don't want to be here. I don't like this. I'm kind of nervous right now. The treatment sometimes only focuses on certain things and does not fix an underlying mental health problem. Example is the treatment might deal with something else, but the main problem might be a different health problem, like unhealthy childhood. Because psychosis can be caused by seeing a traumatic event, like having a traumatic childhood, like child abuse, that can cause psychosis because it would mess with the brain. And just anything that would scar someone or mess with their mental state. So, and this may not get at that, it may get at something else, may gonna help, but not fix the main problem, to bring back their symptoms of psychosis they had. Alright, electroshock therapy. The third treatment is electroconvulsive therapy. This is when electrodes are attached to a person's skull and a doctor sends a small shock to the brain. This is done 2 to 3 treatments a day for several weeks. What this does is cause a small controlled seizure. This causes medication to work better and change a person's mood. Also, it can help non-pregnancy medication work again. One of the pros that can help speed up treatment for women that are pregnant, I actually looked it up, it's actually true. This can help because a woman is pregnant and due in a few months. It can help speed up the treatment, which means the woman could have the mental problems fixed before the baby is born, which means the baby wouldn't have to be taken away to be with their own mother. They're being placed into foster care because if the mother still has mental psychosis symptoms, they could be prone to homicide because that's one of the symptoms and may not be suitable. Treatment can also help with patients who are refusing food, which can cause nutritional deficiency. This means that if the patient is refusing food, treatment can help make them eat again. Because nutritional deficiency is actually not great. It can make a person really sick or not get enough stuff to protect them from a virus. Definitely in these times, you need that. This third treatment can also help out with patients with a patient's depression that is resilient to other treatment. Treatment can also help out with medication, like a depressive medication does not work. So you have a really strong depression that doesn't not affected by the other treatments, and this treatment can help fix that. Following electroshock therapy. There are some downsides to treatment. One of these is confusion. This can happen a few minutes right after the treatment. The effect is that you won't know why you're there, how you got there, and this could cause additional anxiety or fear. If you would basically wake up strapped down to a table, not knowing how you got there or why you were there, and this would terrify someone because you feel like you're in a horror movie, but you'll be very scared because you don't know why you're there. This effect can last a few minutes to several hours. On rare occasions, it can last for 7 days. So for 7 days, you wouldn't know why you're at this institution. And it's more noticeable in older adults. Another effect is memory loss. It can cause the patients have trouble remembering events before the treatment. So you wouldn't remember stuff that well, not just why you're there, but stuff from the past. They can be either from weeks to months or years, and this is called retrograde amnesia. The side effect does go away after a few months. So for a while, you wouldn't remember stuff years ago or months ago. Just forget that. And again, that could terrify someone. Alright, continue. The treatment can also cause physical pain for the patient. Example, in the jaw due to clenching during the seizure, nausea, headaches, and muscle ache. Because your body can also contract during it because you're getting shocked. But it can be treated by using painkillers and Tylenol. One higher risk is when administering anesthesia causes medical complications. During the procedure, the patient's heart and blood pressure increases. In a rare case, it can lead to serious heart problems, but is more dangerous who already have existing heart problems. So if you don't really have a heart problem, there's a really small chance of you having this problem after. Alright, cognitive enhancement therapy. Cognitive enhancement therapy teaches people how to recognize social cues or triggers, improve their attention, memory, and ability to organize their thoughts. It also combines computer-based training and group sessions. This treatment also works with people who need help with schizophrenia,
There you go.
and related cognitive disorders, improve brain and cognitive development, social coordination, and increase vocation capabilities. Also, cognition is one of the biggest disabilities for a person who are recovering from mental illness. And CET targets cognitive defects that limit recovery. Also, medication is helpful for most people. Medication is helpful, but it's not helpful for improving cognition. Medication might help get rid of like the visions or like the blurs you see or the voices you hear or the anxiety you feel, but you need like therapy to help out with cognitives. Alright, pros of cognitive enhancement therapy. Benefits are that they make a person better at paying attention and help make the treatment go by more quickly. The person is more focused on the treatment instead of like feeling anxious or not wanting to do this or like spacing out and looking around. They'll be more focused on this, wanting to like get it done. Another is that the treatment can help improve the patient's memories. So it can help this can help remember past traumas, give the therapist more materials to work to help figure out what caused it, the best way to treat the condition. You may want to make yourself forget why you have this. If you have like an unhappy childhood or saw a traumatic death, you don't want to remember that, but this can help you remember it. It can also help raise a person's motivation, and this can help because the therapist can't fix it on their own, like other treatment. They have to get help. This means that they are more motivated. The person, wait, hold on. So that means the more motivated the person is, the better treatment will get. Alright. The treatment also helps with the person's dependability, and this can be very important. The reason for this is that the treatment can help incorporate a person with mental disorder back into everyday society. Like I said before, it's going to be helpful. They can get a job and and pay for more treatment if they need it. So that could help. Another is mental stamina, or as it's called, mental toughness. This can help because it improves a person's mental state and can help protect a person from different types of psychosis symptoms that could come up in the future. So you could be cured of one thing, but a few years or months later, something else will come up, like something else traumatic happened. Well, this will help protect you against that. If you have a better mental stamina now, your mind is more stronger. Funny thing was, I could never find cons for that one. Not very funny. Conclusion. In conclusion, all treatments fit different people's needs. I know this is supposed to be about why three treatments are better than another one. As I wrote this, I found more info. This led me to find out that each treatment is made for different people who have different kinds of psychosis, because there's hundreds of symptoms. There can be hundreds of combinations out there. In conclusion, no treatment is better than the other. They're all made for each kind of psychosis condition. But each treatment does have their own cons, and this does not affect the other one, but it does show in their own way that they could be improved to fit the patient's needs better. This would greatly help the people in the future. Simply, is no size fits all person. Each person has a different one. In the beginning, I thought that one would be better than the other from what I read, but as I read, they're all the same, just fitting each person to what they need to get better. And that's really it. Any questions?
I have a question. Like if someone wasn't feeling well, where would they